Hello, everyone, and welcome back to Voices Speak Volumes. Today's guest is Heidi Romero, Director of Community Advancement at Jericho Road Community Health Center. Jericho Road is one of 8 organizations that we will be joining once we make our move over to 1021 Broadway. Now, Heidi, how are you feeling about the move? How's it going?
It's busy. I think I have the easiest part of the job. I'm just kind of making sure that folks have what they need. But I'm feeling good. I'm excited. I think Jericho has been looking forward all year for this move to happen and for the agencies to be able to join us at 1021.
Yes, definitely. Us too. We've been looking forward to it for sure. So can you tell us a little bit about your background and how you came to work for Jericho Road?
Yeah, sure. So I've been with Jericho Road for over a year. It'll be 2 years next April. So I'm pretty new as an employee of Jericho Road, but the whole time I've lived in Buffalo, I've always been connected to this organization. I truly believe in their mission, in their values, the work that they are spearheading in the community, as far as providing medical care and programmatic support to everybody, especially those who need it most. My background is, I would say, in community health, social determinants of health, project management. A lot of my work actually has been working in the private sector. But luckily in the private sector, there was always a philanthropic component, a social corporate responsibility component, an employee engagement component. And that's kind of what I always lean towards until I took the plunge to come join the nonprofit side a few years ago.
Yes, that's awesome. You guys do some amazing work. You guys really do. So I'm glad that you jumped on board with Jericho Road for sure. So what are some things that you're excited about with the move?
I would say the biggest piece is when I think of 1021 and I think of all the agencies that are coming and everything that's going to be there, it's almost like a model of what healthcare and health services could be, right? We're having medical care for everybody. We're having behavioral health and mental health opportunities, programmatic care from children all the way up to the elderly, dentistry's coming. I don't know. The list can go on and on, but when I think of all the services and resources that are going to be available for everybody, I think that's what I'm most excited about. It's really going to be, I don't like the term one-stop shop, but that's really what it is. The whole family can come and get cared for.
Yeah, the easier that we can make the lives of our families, the better it is. And I think now more than ever, people are looking for all of these different options, mental health, behavioral health. So once again, you guys do some amazing work. So I'm excited to work with you guys as well with our agency. Definitely.
Great.
Yeah. So what kinds of services and resources do you guys offer that might be useful for the special needs community?
The medical care that is offered, it's for the whole family. So pediatrics, OBGYN, wellness, immunizations, that's really for everybody. The programmatic support, so we have programs like the Priscilla Project, which is for pregnant moms, and there's mentorship and doulas and services. We have our Hope Refugee Drop-In Center. They're located on the west side, and they do everything. I mean, you can go in there. Before COVID, the English as a second language classes were provided. Citizenship classes were provided. You can go in there with, I would even say, a job application, needing help with this, to fill out a SNAP application, and you will get the help that you need. So we don't necessarily have something that is just geared towards one population. It's kind of for everybody.
That's awesome. Yes. So are there any other fun projects or developments that are going on at Jericho Road that you'd like to discuss?
So I think an organization that moved in about 2 weeks ago, so the full title is the John R. Oshai Children's Hospital Broadway Pediatrics.
Yep.
So they're already in the building.
I
One of
actually
them.
got an opportunity to speak with Dr. Quo, Dennis Quo, on
Oh,
last week's episode. So yes, definitely
no,
familiar with their work.
it's great. It's really great to be able again, it's all about serving the community, serving children, serving families. Having them there has been a great addition. Um, and I would say the next exciting thing that's going to be happening, where the dental clinic is going to be opening in
Right.
November.
Mm-hmm.
And the model will follow Jericho Road's model of, accessibility for
Mm-hmm.
all. So I think that's going to be a game changer for the community. I don't even know where folks go if they have, if they need dental care, if they have a dental emergency. I don't even know where they would go if they're kind of living in that neighborhood. So I think those are two huge, exciting opportunities. The MOG, which is our medically oriented gym, the staff and the team are working, very hard to be able to open the gym up again, and that offers physical therapy, occupational therapy. So I don't have a date for that, but I'm hoping, maybe sometime in Q4.
Mm-hmm.
As far as the green space, which we're calling kind of the superhero corner on Clark and Kent. So the programs that are happening now, it's wrapping up on October 24th is the last day for that. But Algonquin Sports for Kids has provided free play, soccer, tennis, football, bubbles, chalk, anything, a kid could want since July. So that
Mm-hmm.
wraps up this month, but they do plan to come back next year. So that wasn't a one and done type of
That's good.
opportunity.
Mm-hmm.
And then Epic Story Time in Your Neighborhood. That has been a great, great addition. In September, we celebrated Hispanic Heritage Month. So Talia Rodriguez of Westside Promise Neighborhood, she was our Spanish reader. So that was like really, it was just, I think it was very cool to kind of have a known West Side organization come to the East Side and, be part of that collaborative. So that's going to keep happening through next year, but it'll go virtual.
Mm-hmm.
So again, medical programmatic care for the whole family is being
Mm-hmm.
offered.
Yeah, I love the fun little outdoorsy stuff that you guys have going on. It's definitely exciting. Obviously we've all been cooped up in the house and it's going to get cold really soon. So
Yeah.
definitely I would encourage everyone to take advantage safely, socially distanced, wearing face masks, of course, but definitely take advantage of those services. Yes, for
Yeah.
sure. Yes. So thank you guys so much for joining us today. Thank you, Heidi, for joining me today. I really appreciate it. And as always, our contact information will be available down below if you have any questions. And yeah, thank you again for watching and have a wonderful day.